Hi everyone and welcome to another episode of Oaktree TV. I'm Dave Kemp and today I'm joined by Dr. Brian Taylor. Brian, say hello.
Hi, Dave.
Hey Brian, thanks for joining us today. So the reason I wanted to bring Brian on today is to talk about his new book that he's recently published, Interpersonal Audiology, Effective Communication Skills in the Era of Patient Autonomy. So Brian, why don't you tell us a little bit about this new ebook that you've published?
Sure, I'd be glad to. Well, it's a short little book. It's about 150 pages. And the basic idea is to provide some practical guidance around patient-centered care for clinicians. And I think one of the motivators behind the book is as technology has gotten better and more sophisticated, it's sort of ironic that people skills are probably more in demand than ever before. And so the book tries to acknowledge that and provide some practical guidance on how to use those kind of skills in the clinic.
Very cool. So let me ask, what prompted you to write this book?
Well, kind of along those lines, I think technology is getting more and more sophisticated, and you're really right, I think, really eloquently about this, how hearing aids and consumer audio are kind of morphing into these hybrid devices. And so things are becoming more automated. We're seeing machine learning, artificial intelligence, all of those kinds of things inside of amplification devices. And the irony, I think, is that clinicians are more reliant or need to lean more on their humanistic or their people skills than ever before. It's one way to differentiate your practice, especially in a world where there's self-fitting and hearing aids and other over-the-counter kinds of amplification devices.
Yeah, no, I think that's a really good point. I mean, I think that there's definitely this wave of new technology that's coming from the consumer side that's influencing the medical side. And what's really interesting is the medical side is also influencing the consumer side. So there really is sort of this convergence toward the middle, I think, where the consumer side and the medical side are kind of converging toward. So I know early on in the book, you talk about this dual role of audiology in healthcare. So can you elaborate and expand on what you mean by this?
Yeah, sure. That's another dichotomy that we can talk about. I think historically, audiologists, and to a certain extent, hearing instrument specialists, their primary role in the healthcare system is to detect possible cases of ear disease or what some people call retrocochlear pathology, and then make the proper referral. After all, we have the 8 red flags as part of our case history. We have air, bone, and speech, and that's all supposed to be done in a very precise and accurate way. And that's the medical side. That's one role that we all play, and that's kind of goes with the territory when you get your license, that you have to be able to do that well with accuracy and with precision. On the other end of the equation, however, those skills around accuracy and reliability of testing, those skills are really not all that useful, in my opinion, when it comes to working with patients that have a chronic condition. And a lot of times, I think clinicians misapply the medical model around acute care when they're working with people that have a chronic condition, like most people we work with that have different types of age-related or other benign types of hearing loss.
That's interesting, and yeah, I think that's definitely something that is a consideration that some people might not be thinking a whole lot about that dual role that you had mentioned there. So I think that's definitely going to be an interesting aspect of the book. So I know that along with this book that you've just recently released, you have another book that you've published in the past called Audiology Practice Management. Can you talk a little bit about that book?
Sure. So it's actually the third edition of a pretty well-known series that the publishers, they're called TIMA. It's a German publishing company. And the first 2 volumes were edited by Mike Valente there in St. Louis at Washington University, and Holly Hosberg-Dund, who's an audiologist in private practice in Arizona. Well, they kind of stepped away from things, and now myself and a couple other authors have come out with a 3rd edition. My volume is the Audiology Practice Management, and it's really just nuts and bolts around how to operate in a private practice or in an ENT audiology practice. And so there's several co-authors, about a dozen of them, that contributed to the book. They did a great job, and I think it's a really good piece of reading material for those that are interested in the business side of audiology.
Yeah, I think that's a pretty important side to the whole, facet of everything. So let me ask, as we wrap up here, where can people go to find interpersonal audiology and audiology practice management?
The practice management book is actually, you can find it on the web at TIMA Publishers, and TIMA is a German word. It's spelled T-H-I-E-M-E. You can find that on the web. I think it's released just this month. And then the ebook that you mentioned that we talked about first, the Interpersonal Audiology ebook, is available on the blog Hearing Healthcare and Technology Matters. And if you Google that, I'm sure you can find it. And for a very nominal price, you can possess that book.
Perfect. Well, I'll link both in the show notes so that people can go and just quickly link to those if they want to buy them. So Brian, thank you so much for taking the time here to chat with me today. And thanks to everybody for tuning in this week. We'll see y'all next week.
Yeah. Thanks, Dave.
Absolutely.